Hi, it's Dr. Erica. Thank you for joining me on this particular video. I am pharmacist, doctor of pharmacy. Thank you for joining me. I am the owner and founder of Millennium Pharmacy, based here in Alabama, and I am proud to present the Eye, Ears, Nose, and Throat series of the platform here on YouTube. Please stay tuned to the end of the video. Like, share with family and friends, and also subscribe for future content, as well as feel free to see the other videos that I've uploaded in this series as well that may be helpful. I am a pharmacist for close to 10 years now. I work independently as an independent pharmacist, and I would like for you to continue to join me on this particular platform, support my business. My website is also listed in the description as well. I'm also on Twitter and TikTok for more content. So this particular series talks about sinusitis, which is the pressure and bacterial infection of the sinus areas. Now that can consist of fluid retention, that consists of pressure and inflammation of the lining of the sinuses as well. So there are some symptoms that can be treated with over-the-counter medications like the nasal, topical, nasal decongestants, such as the oxymetazoline, also the hydrozoline as well. Those particular ingredients are available as nasal decongestants. There are oral decongestants like the pseudoephedrine products and also phenylephrine that can be purchased in your pharmacy. Now, pseudoephedrine might have some extra controls that surround its purchase, so do be aware of that. Phenylephrine is more freely sold because it doesn't have the dependence or CNS stimulation like this pseudoephedrine does, but they both are very effective and I do recommend them. Also, there are humidifiers that can be used, warm water. There's some saline solution washes that can also be used over the counter to help irrigate the nasal passage and mucous membrane so that infection will not occur, and so that the eradication can also begin. Now, there are also some bacteria that are known to cause sinusitis, and that's going to be the streptococcus pneumoniae and also the haemophilis influenza. Now, these particular bacteria are known to cause upper respiratory tract infections, which includes the sinuses as well. 70% of cases are caused by these particular ones, and some of them may be caused by a different bacteria, but more so 70% will be caused by bacterial infection. Now, the first line therapy is usually going to be amoxil or moxicillin, 500 milligram given twice a day for 10 to 14 consecutive days, as research trials have studied and have recommended. Now, this particular medication is cost effective. It is usually tolerated unless there's a hypersensitivity. If there's a hypersensitivity, then the patient can either start on a second generation or third generation cephalosporin, or they can also try another class or another group of medications if they have a true allergic reaction, such as hives and anaphylaxis. And that particular type of allergy will be warranted to start like a Bactrim or also doxycycline or azithromycin pack. Also, it could include clindamycin as well, levaquin or levofloxacin, moxifloxacin. Those particular ones, a group of antibiotics, can be used if there's a true allergy. When I say true allergy, that means swelling of the throat, decrease in breathing, also hives development, anaphylaxis type treatment where epinephrine might be needed in an emergency case. So again, amoxicillin is going to be your first class or first choice. And then after amoxicillin, if there's an allergy, we want to move to the cephalosporin second generation, such as your cefprozil, your Omnicept. All of those are warranted with allergy that is not very prominent, but the patient may be allergic to amoxicillin, so we want to start with the cephalosporin. Okay. Now, there are also other classes of medications in the event that there's a recurrent sinusitis within 4 to 6 weeks prior to the current infection. In that particular case, we want to use higher doses of amoxicillin or stronger amoxicillin doses, just because there might be a need to um, go further or stronger as far as eradicating the bacterial infection. Now, also, if there is a suspicion of penicillin resistant bacterial infection, then we want to go further by using higher doses again of amoxicillin. We want to start begin with other medications instead of the amoxicillin if there's a suspicion of a penicillin resistant bacterial infection. Okay, and I'll go over some of those. So stay tuned to the end of the video as well. Okay, now there's different types of sinusitis. There's acute form, there's chronic form, and there's also the failed form of sinusitis. That means that after 3 days of treatment, no relief of sinus symptoms, no relief whatsoever. So that is the failed form of sinusitis. And then the chronic form is going to be having sinusitis for greater than 3 months. Okay, symptoms are prevalent, no antibiotic response. Then a specialist is going to be needed at that particular time. So that is very serious, very much so. There might be some more invasive therapy that need to be conducted, such as puncturing the sinuses to relieve pressure, to relieve fluids, and so forth. So that is the chronic form. Acute form usually it's going to last less than 30 days. Symptoms will begin to reside in a few days after the antibiotic treatment is commenced. So that is considered the acute form. Okay. I've gone over some of the symptoms. Symptoms that may be headache, pressure, maxillary tooth pain as well, especially for children. There might be a swelling in the facial tissues, especially in kids and sometimes adults. Rhinitis, runny nose may be prevalent. Facial pain may be prevalent as well. Cough, fever, and also laryngitis can be prevalent in those particular populations, just because the larynx is so close to the upper respiratory tract infection of the sinuses that the bacteria may also travel to other places to increase or to spread the bacterial infection. And that can be the ears, that can be the throat. So do be aware of that as well. Some of the medications that are used for treatment, again, is going to be first line therapy, amoxicillin, 500 milligrams twice a day. Take with plenty of water, usually 8 ounces of water. And then if non-tolerated, you may take it with the meal. But if you can not take it with the meal to help increase absorption, that'll be better. And then the recommendation for higher amoxicillin dosing will be 2 grams twice a day. 2 grams twice a day for 10 to 14 days. Nausea and vomiting, diarrhea, rash are some of the side effects. And it's contraindicated for those who have a true allergy to penicillin and cephalosporins. So you don't want to use amoxicillin in those particular populations who are known to have those hypersensitivity to penicillin and cephalosporin. And again, store the suspension form of the amoxil or higher doses in the refrigerator at cold temperature. It is a suspension, so you want to shake it very well before dispense or before treating or administering it to the patient. Okay. Now, if there's a penicillin allergy or the situation is still uncomplicated, then you want to start with your cephalosporins, second and third generation. That means that the patient is allergic to amoxicillin. They can't take the amoxicillin. It's uncomplicated type sinusitis. So again, we want to start with the cephalosporin. Okay. And then also, now the cephalosporins, I'll go over that particular class. That particular class is very special because it covers a broad spectrum of infections, and they are very economical as far as pricing. They're very versatile, again, or broad spectrum. I'll go over those briefly. Now, it is recommended to separate cephalosporins from other medications, such as your multivitamin, your minerals, because those can interact with cephalosporins in the GI tract and cause interaction where cephalosporin is not absorbed through the GI tract. And we don't want that, okay? Also, a side effect of cephalosporins is going to be vaginal infection. It can be diarrhea as well. So if you're taking estrogens and progesterones, medications, that is a possible drug interaction as well with the cephalosporin. So do be aware of that. Also, if you develop any type of rash or itchy sensation, do stop the cephalosporin and let your doctor know so they can treat you with a different type of medication. Diarrhea can again be a side effect. Also, um, the dosing is going to be twice a day for 10 to 14 days. For Septinir, though, the dosing is a one-time dosing or twice dosing with 600 milligram a day. Okay, and that is Septinir or Omnicef, which is very convenient. The mechanism of action for cephalosporins is going to be cell wall of the bacteria, stopping or blocking that cell wall formation of the bacteria, so the bacteria will not have a cell wall to protect itself from the immune system or from other antibiotics. So that cephalosporin is going to go ahead and penetrate that cell wall and knock that cell wall down. And then you'll receive the bactericidal effect or the killing of the bacterial itself. Also, because this particular class is bactericidal and not bacteriostatic, the the more the bacterial is prevalent, the and higher the concentration of the bacteria, the better for cephalosporin to work. Okay, and it's good for patients who have a recurrent infection, um, one that has been previous in 4 to 6 weeks prior, and also those who have a non-serious allergic hypersensitivity to amoxil. Okay, so there are some other medications that can be used for treatment, and I'll go over those. Okay, people who have a penicillin allergy, a true penicillin allergy, those are the people who are going to go ahead and receive Bactrim instead of amoxil, instead of cephalosporin, amoxil, and again, cephalosporin will be ruled out. They will receive azithromycin, Bactrim, Levaquin, clarithromycin, or the vibramycin or doxycycline instead. Okay, and those are the patients that I will go into more detail about their medications. So stay tuned, okay? Now, Bactrim is a double strength at 160 and 800. It is a component of the sulfamethoxazole, and the other component is sulfamethoxazole, which has sulfur in it. So if you're allergic to sulfur, Bactrim is not going to be very well tolerated. It might cause that allergic reaction that may cause you to have to be placed on a different medication. So let your doctor know about your allergies as well. And it's given every 12 hours for the same 10 to 14 day consecutively. And then also you want to take it with a full glass of water and watch out for skin rash. Also, if you're taking anticoagulant medications and also sulfonylurea for glucose control, do be aware that this spectrum can interact with those particular medications. And so your doctor can make adjustments during that particular 10 to 14 day period. Okay, avoid direct sunlight with Bactrim as well, just because it causes a sensitivity in the sun, and it may also cause diarrhea as well as the sulfa allergy that I mentioned. Now, Biaxin is another medication, Biaxin or clarithromycin. This particular medication works by blocking the protein synthesis of the bacteria, And again, it's going to be 500 milligram once a day for 14 days. And it's going to change the taste of the perception of taste. And it's also going to cause diarrhea. And it's also going to cause colitis or pseudomembrane colitis, which is part of the diarrhea effect. So do be aware of that when taking Biaxin or clarithromycin. If there's a hypersensitivity or intolerance to it, let your doctor know so they can make adjustments accordingly. Now, azithromycin is another medication that can be utilized instead of amoxil and the cephalosporins, and it's going to be for 3 days dosing, which is very convenient for the patient. You're going to take 500 milligrams for 3 consecutive days, and it's not for complicated infections. It's more for the patient who has that true allergy and who's going to who has an uncomplicated but true allergy, sinusitis, okay? And then you want to take it with no food if possible, no antacids, and then the side effect profile is decreased. There's not a whole lot of side effects with this one except maybe diarrhea at the most. So that's very convenient, and I would recommend it. Now I want to go over vibramycin, doxycycline or vibramycin can be used in those who are 8 years of age and older. Those who are younger than 8 years of age is not recommended just because there is a side effect of a change in tongue coloring and also teeth discoloration as well in those particular populations. It's recommended to avoid sun exposure when taking doxycycline. It is known to cause diarrhea and GI upset. So take it with the milk or with a food product if you can. But again, over time, it's going to cause that diarrhea effect. It might be tolerable in the beginning, but with so much use, then patients begin to say, well, I can't take it any longer. I've tried it. Is there something else? So do be aware of that. It works by blocking protein. It is a tetracycline class of medications. Now, C. difficile is prevalent with tetracyclines, causing diarrhea, and do be on the lookout for drug interactions with multivitamins and minerals, and also estrogens and progesterone medications as well. So separate these medications from other medications by 1 to 2 hours, and also your doctor can make adjustments to your prescription while you're on other medications. And it's a 12 every 12-hour dosing. Drink plenty and plenty of water. And again, the sun exposure can be detrimental, causing rash and skin irritation. It is bacteriostatic instead of bactericidal, so it doesn't actually kill the bacteria. It kind of just lessens the concentration of it. And so this medication, I would not choose it as one over the Bactrim. I would not choose it over the azithromycin. I would go ahead and get something that is cidal to go ahead and knock it out of the ballpark. So that is my suggestion. Those are the medications that I wanted to go over in detail. Levaquin, I'll go over some of the Levaquins and also clindamycin, because these are for complicated situations, such as people who have failed or who have gone through this recurrent sinusitis over and over again, especially within the last month or month and a half. And also those patients who may have a suspicious penicillin-resistant bacteria that may be prolonging eradication. I'll go over the Levaquin and also the Cleocin as well. So Levaquin and moxifloxacin. Levofloxacin is the generic for Levaquin. Moxifloxacin is also in the same class as levofloxacin. They are not recommended for children because of muscle tenderness throughout the body, muscle pain that has been reported. So I do recommend it only for adults. Now, this particular medication of class, they work by blocking DNA bacterial production. Okay, and it's recommended to drink with plenty of water, and also avoid sunlight exposure as well. They interact with warfarin or coumadin and antacids, minerals, and vitamins. There's a large drug interaction profile with this particular class of medication. They cause QTC, or QT, prolongation of the heart as well. That has been reported. Liver dysfunction. Patients use this medication with caution. And also, patients who have arrhythmia or anti-arrhythmia drugs on board, they should also be aware of the side effect. Also, patients who have seizures can use caution as well. There's been seizure reported. There's also been glucose disturbances that have been reported with monitoring. So Levaquin is a popular class. It does the job. However, there is a large drug interaction, a large cautionary profile with these. Now, clindamycin or Cleocin is 450 milligram every 6 hours. Drink with plenty of water as well. It's in a different class of medications than the levofloxacin and also the moxifloxacin, and then also the cephalosporins. Now, the clindamycin is recommended to have no food on board. It works by blocking protein production of the bacteria, and those who have GI upset or diarrhea should use this particular medication with caution, just because that's one of the side effects. Okay, now those are the 4 medications that are used for complicated sinusitis. Complicated sinusitis is defined again as those patients who have recurrent infection, especially one lasts in the last month or month and a half, and no symptom betterment of the symptoms. And also those people who have a penicillin resistant type bacteria, they should, or high suspicion that they do have that, then that's why we're going to try the Cleocin, the levofloxacin class, and then the cephalosporins. Okay, so we're going to try those in complicated situations. Non-complicated situations can be those who do not have a serious reaction, those who are maybe just slightly allergic to moxil or cephalosporins. Then we're going to go with azithromycin, the clarithromycin, the Bactrim. So we're going to stick with those during those particular cases. So do be aware that antibiotics are very important. The more resistant, the stronger, the longer we're going to have to use these. The more invasive we're going to have to go. We're going to have to involve specialists. Knowing that they're complicated, they could also travel throughout the body to other areas of the upper respiratory tract infection, which is going to be your otitis, your throat, the laryngitis, the pharyngitis. So it is very complicated, but it's doable and it's treatable, and healthcare providers are knowledgeable, and research is still going on to help eradicate and better our antibiotic therapies. The suggestions that I've given are for the U.S. If you're watching this from overseas, if you're watching this video in another country, the suggestions that I've made are from guidelines that pertain to the states, the United States, maybe Canada as well, just because we're in the same climate region. And so bacteria seems to act very similar in certain climates and in certain hemispheres, just because of the weather, the climate, again, the environment, the host, are the people that they tend to live among. So that is why I say the information that I gave is mostly pertaining to the U.S. Check with your local health guidelines and officials to learn more about what is recommended for that particular region. Okay, so thank you for joining me. I'm Dr. Erica. This has been a video about sinusitis, treatments, symptoms, how to go along with self-care over the counter versus using antibiotic prescription therapy, and also what to expect when chronic sinusitis is suspected. So also, I've gone over the cause of sinusitis, what bacteria are usually involved, what percentage of sinusitis is involving these particular bacteria, and also I've gone over the different types of sinusitis, the more chronic versus the acute versus those who have been failed sinusitis cases. So do be aware of the differences. And I thank you for joining me on this particular video. If you have any questions or comments, please leave them. Check out my description for any clarification. Please watch this video again, share it with loved ones. Visit my other videos as well about eye, ears, and nose and throat diseases such as glaucoma, allergic rhinitis, also mucus of the throat. I'm going to put up more videos about infections that include otitis media and conjunctivitis as well. I'm also interested in learning more about bacteria and antibiotic treatments as we go along. So I have been a registered pharmacist for the retail, and I have dispensed a lot of these medications to both pediatrics and adults, and I've had the privilege, and I'm very grateful for that. And also, I work with healthcare providers, physicians to help get prescriptions to the patients and for the patients. I've collaborated before dispensing to make sure that these are appropriate antibiotics for the patient as well. And then upon dispensing, we do consultations before the patient is actually leaving. We make sure that they understand how to take the medications, what to look out for, side effects, and so forth. So I am, again, Dr. Erica Onigbola, pharmacist and owner and operator of Millennium Pharmacy. Thank you for joining me. Have a great day. Bye-bye.